I'm coming. I've been here waiting since. What are the four main categories of disabilities? We talk about behavioral or emotional, sensory impaired disorder, physical and developmental. Is that where we stopped?
Yes, sir.
That's where we stop, Abby?
Yes, sir.
Okay, so we want to start explaining, or did we explain them yet? I don't think we explained them.
Sir, you said in our next class you explain it.
Okay, fine. Okay, and this is your next class. Let me see if I can send. Let me see if I can send the material to. Is Chidera in the class? No. Oh, okay. Chidera is in the class now.
She's in the class.
And she just entered the class now. Let me just send the material to her so she posts immediately on your class group. Let me just look for the material and send to her. Let me send the material to her now. But that is not all about the class, at least so you can follow me as I continue the class. I've promised to send the material a long time ago. Oh, Jesus. Hello, Chidera. Chidera. Chidera.
Sir.
Have you
Good
seen it?
afternoon. Yes,
Good
sir.
afternoon. Have you seen it? Oh, yeah,
Yes,
post it, share with them now. Oh, yeah, share with them now. Do we all have it now?
Yes, sir.
Okay, fine. So I think I'm on page 5, if you can check. What is behavioral emotional disability or emotional? Are you there? The page 4 said there are 4 main categories that define disabilities. Are you with me there? Please respond. Let me hear. Let me know if you are following me.
Yes, sir.
Okay, let's
Yes,
continue
sir.
from. Okay, let's continue. Fine. So he said there are 4 main categories that define disabilities. We said behavioral or emotional, sensory impaired disorders, physical or developmental. Now, what is a behavioral emotional disability? A behavioral disorder can be disruptive, and if it is not diagnosed in childhood, it can impact a person's ability to hold down a job and maintain relationships. That is how bad it is. Behavioral disorders include anxiety disorders, dissociative, not associative, dissociative disorder, finding difficult to associate, disruptive or impulse behaviors, and pervasive development disorder. Emotional disabilities are a type of behavioral disability, but that is because our emotions often influence our actions. An emotional disability often relates to a disability that prevents a person's ability to maintain or build interpersonal relationships with others. So somebody who is having behavioral emotional disability will find it difficult to build interpersonal relationships with others. They can also struggle to control their emotions and often feel unhappy in their life. This means they often act inappropriately in normal circumstances. Even in a normal circumstances, you see them behaving inappropriately or suffer with feelings of fear or anxiety, especially in relation to personal matters. So that's what about behavioral emotional disability. Then there's what we call sensory impaired disorder. It's also a disability. You know, when we say sensory, we have how many sense of organs? I mean, who can remind us how many sense organs do we have? Somebody should talk.
5, sir.
5. So you have the sense of hearing, seeing, taste, feeling, and smelling. Am I correct? So somebody who is having impairment in this disorder, that means if any of these 5 can be affected. This type of disability is quite self-explanatory. That is, it is what we can easily explain. It is what is visible. This type of disability is quite self-explanatory as it relates to the senses: hearing, smell, taste, touch, and sight. If a person has a sensory disability, this means that the senses are no longer at the usual levels that others experience. You know, there are different levels. There is a perfect level. So, for example, those who are using glasses are not at the usual level with those who are not using glasses. So there are levels. And those who are using glasses are not at the same level with those who cannot see at all. Do you not get the 2 levels, the levels now? And if you see somebody using glasses, if you check the how will I put it now, the numbers of their lenses, the number of the lenses are not the same. I hope you know that. There are some, their own is just minor. There are some, their own is so thick. If you see their glasses, it will look like the bottle of Coca-Cola, the thick bottle. You get it. So there are different levels. So that tells you that those who are having problem with the senses are no longer at the usual level that others experience. For example, if you suffer with a vision impairment, this could mean that you need to wear glasses to improve your sight or vision abilities. However, there are more serious vision impairments, and some people are unable to see at all as they are blind. So can you see different levels now that we're talking about? Hello? Hello? I want you to talk.
Yeah.
So please respond when I'm talking. Respond when I'm talking. So I know that we are together. If you're not disturbed, unmute your mic. So this talks about the different levels of sensory disability. If you have hearing difficulties or are deaf, you may have a hearing aid. Have you seen that hearing aid before? And this is classed as having a hearing impairment. Many older adults also report sensory issues in relation to their taste and touch. Some people, they say, I'm not feeling what you said, this thing is sweet, but I'm not feeling it. They may have problem with their sense of taste. I know a man who has issue with his nose. You know, if the man is sitting here and there is gas leakage, the man will not perceive it. And it is very, very dangerous. So the man went through surgical operation to correct that. So you can see different levels. It could be as a result of taste, as a result of touch. Some people, maybe they have numbness in their body. They don't feel it. Even when they are being touched, the skin is, get it. So you could have sensory impaired or disorder. Do we get that? Hello? So the next one is physical disability. Physical disability. A physical disability is physical abilities, stamina, mobility, or the ability to move and use their hands. There are many obvious physical disabilities, but even a condition such as epilepsy is a physical disability, even though you may not be able to tell visually or by speaking to the person. That is because a seizure incapacitates the person who has this condition and can place limitation on person's life. Other physical disabilities include 1, brain injury, respiratory disorders, hearing impairment, spinal cord injuries, multiple A developmental disability refers to condition that occur during years as they affect a person's ability to develop in the same way as others. They impact a person's ability to learn, impact their language, or initiate behavioral difficulties within a person. These types of conditions are said to develop through childhood up to the age of 22 years old. There are said to be 5 developmental disabilities, which include attention deficit hyperactivity disorder, ADHD, attention deficit hyperactivity disorder, cerebral palsy, autistic spectrum disorder, intellectual disability, and learning disabilities. Developmental disabilities are often described as being severe and chronic because of the way they limit the person's life. They can impact self-care, learning, mobility, self-direction, economic self-sufficiency, receptive and expressive language, and independent living. I want you to take up these 5 developmental disabilities and write on them. Attention deficit hyperactivity, cerebral palsy, autistic spectrum, intellectual disability, and learning disabilities. I want to see the number of people in the class. Now, you are 8 in the class, if I'm correct. And this
Yes,
is 12. You said what?
We are 8 in number.
So, Chidera, take the attendance now, the 8. And those are the 8 I'm going to collect the assignment. No, that person is.
Sir, what's the mode of submission? Mode of submission for the assignment.
Take the number of people in the class, the 8 of them, and write on the 5 developmental disabilities: attention deficit hyperactivity disorder, cerebral palsy, autistic spectrum disorder, intellectual disability, and learning disabilities. So write on there. So we move straight to visible versus invisible.
Sir.
Yes, I'm hearing you.
She's asking what is the mode of submission? Is it through
assignment?
Is it online?
What are you saying?
Assignment.
It's not online.
The assignment, is it online? That is soft copy.
I will think about that.
Okay, sir.
I will think about it. It's going to be soft or it's going to be hard copy. How you are going to send it? We work that out. Don't worry. At least that stands as an assignment for you. So let's look at visible and you said what?
Sir, there's another thing.
Okay.
Amadi Precious.
Don't tell me anything about anybody that is not in this class, because you never said that before I gave assignment. So don't give any excuse for anybody. Give me the 8 names that are in the class now. That's okay. So let's talk visible versus invisible. When we refer to invisible disability, we are referring to a disability that presents itself in a physical form to the naked eye. That is, it is visible. People can easily see it. That is what I mean visible, to the naked eye. That means it is often obvious that a person has a physical disability, but some conditions are not so obvious to spot. They are not so easy to see. You may have had some disabilities being described as invisible. And this term is referred to the conditions that are not so obvious. This means that when you look at or communicate with the person, you may assume that they are fit and well, as they don't appear to have a disability. That is why it is important to understand the difference between the two. People who have an invisible disability often claim that they feel others do not always believe they are disabled because their disability isn't easily noticeable. Now let's look at visible disabilities. A visible disability is a disability that is obvious to the naked eye and easily noticed by others when they look at or talk to the person with disability. For example, a person may not be able to physically move in the same way as others, may have a missing limb or facial feature, or have an obvious tremor or shake, all of which are noticeable to others. That is talking about visible disabilities. Sometimes a visible disability is easier to explain or accept because there is evidence of the disability. This shouldn't be the case, as many people who have invisible disabilities often feel discriminated against and feel that others do not believe they have a disability. Do we understand that? Hello?
Yes, sir.
Hello? Okay, fine. Now, examples of common visible disabilities. There's what we call Down syndrome. There's what we call foetal alcohol syndrome, muscular dystrophy. There is cerebral palsy. There is multiple sclerosis. There is autism, amputations, Tourette syndrome, paralysis. There is epilepsy. So let's quickly look at this. About 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We just look at the 10. Okay. When we talk about Down syndrome, this is a congenital condition. There are often characteristics that indicate a person has this condition, such as a larger tongue, flattened skull, and folds to the inner corner of the eyes. They are also often shorter in height and often have limited social skills and intellectual abilities. These are the signs of Down syndrome. They are all, this is one of the what? Visible disabilities. Then the other one is foetal alcohol syndrome. This is caused by the mother while she was carrying the baby in the womb. You know, don't drink, now waiting, I go drink. Don't smoke, I will smoke. This is caused when the mother of a child drinks throughout her pregnancy, and this causes physical, behavioral, and learning problem for their child. Can you see? The child when they come jeje, the woman destroy the life of that child. Then the other one is muscular dystrophy. This is a genetic condition that causes muscle weakness. It is a progressive condition that gets worse over time. And symptoms can become life-threatening when they affect the heart muscles or the muscles we use for breathing. That is muscular dystrophy. You know, if you are hale and hardy, you don't know what God is doing for you. There are people going around with all this. They are always in pain. The other one is cerebral palsy. This is a motor disability due to the brain and muscles being affected, which affect the person's ability to maintain their posture. They not be able to stand, to maintain their balance and movement. Cerebral indicates issues with parts of the brain, and palsy refers to muscles weakness. And the muscle is connected, the muscle that connects to the brain. So it is brain and muscle problem. This is the most common motor disability in childhood. Do we understand that? Hello? Are we still together?
Yes, sir.
Okay.
Yes,
It's only
sir.
person, it's only Marianne that is talking. No? Okay,
Yes, sir.
I had favor now. Okay.
So
What is the next? You said what? No, change your location. Change your location. I'm not hearing that. What did you say? Change your location. Move away from where you are. I didn't hear what you said. Hello, Comfort. What are you saying?
So I said it's promise. So I said it's promise.
Okay, promise. What did you say?
No, you were saying that it was only Marianne that is answering you.
Okay,
Then I
you
said
two,
it's promise.
Okay, for me to know you are there too. You know go market today?
No, sir. Today is no movement.
Who talks no movement?
Movement no dey our side.
Movement day. Movement day. As I'm teaching from my room. So movement day.
Okay, sir.
So the next one is multiple sclerosis. This is a progressive condition that damages the spinal cord and also the nerves, the nerve cell in the brain. When you hear multiple sclerosis, fear. The person the spinal cord is gone. When the spinal cord is gone, the person cannot do anything. You cannot stand. And again, it has to do with the cell that is connected to the brain. There are many symptoms of this, such as numbness. When you mean numb, do you know of numb? Do you know of numb? Anybody? What's the meaning of numb? Hello? What's the meaning of numb?
Is this when somebody is feeling restless?
No. When you feel some part of your body and you are not feeling it, you touch it and you are not feeling that place is numb. You don't feel it. It's that place is dead somehow. Do you get that? So we said,
yes, sir.
Such as numbness, speech issues. The person may have problem with speech, vision issues, tiredness and fatigue, and muscular coordination. You will not be able to coordinate. The muscles will not be able to coordinate. So these are the symptoms or signs of multiple sclerosis. The next one is autism. Autism. This is a condition which means the brain works differently to others. It is not a condition that requires a cure. Autistic child or children have no cure. Autism has no cure. As of today, trusting God, something can be done. But with God, nothing is impossible. But medically, as of now, no cure to autism. It is not a condition that requires a cure. But people who have autism may need support. A person with autism may find it difficult to understand feelings, may find bright lights or noises overwhelming and stressful, may think or do the same thing repeatedly. They may also struggle with unfamiliar situations or social events, as this could make them anxious or upset. And they could also have difficulty interacting with others. Sometimes it may take a person with autism a little longer to understand information too. The next one of disability or visible disability is amputation. We know that very well. This is when limbs have been surgically removed, such as arm or a leg. This makes it difficult for a person to move or complete tasks in the same way as others. Limbs are removed for various reasons, such as an accident that results in trauma to a limb being deformed or causing issues, or as a result of severe infection or gangrene. So the next one is Tourette syndrome. Tourette syndrome. This condition affects the nervous system. People with Tourette syndromes have tics, which are sudden. Tics simply means shaking of the hand, of the face, or blinking of eyes uncontrollably, which are sudden, uncontrolled twitches, uncontrolled sounds or movements, which people do over and over again. People cannot prevent their tics It is beyond them. They cannot stop that. For example, somebody whose eyes is just blinking, you'll not be able to stop it. Somebody whose hand is just vibrating, you'll not be able to stop it. You get it? People cannot prevent their tics, which could be something like shouting out certain words or blinking their eyes repeatedly. They'll not be able to stop it. So that is Tourette syndrome. Let me ask, have you seen any of these in anyone before now? And you wonder what was wrong with the person? Have you seen any of these? Anybody? No, you are a social worker, and you may come in contact with any of these or some of these. So you should know how to handle them better. That is why we talk about rehabilitation and reintegration. You know, we have not really gone deep into rehabilitation. We have not even started rehabilitation. Hope you know that. But what we are looking at, what will lead people to need rehabilitation is what we are looking at. Because without disabilities, you can't talk about rehabilitation. When you finally rehabilitate them, that is when you now talk about reintegrating them back into the society. Reintegration simply means taking them back to the society. When you rehabilitate them, you take them out to teach them what they will need to survive when they are being reintegrated. So without rehabilitation, you don't talk of reintegration. Do you understand how it goes? And without disability, you can't talk of rehabilitation. Am I making sense? Hello?
Yes, sir.
Yes, sir.
So without disability, there is no rehabilitation. And without rehabilitation, there is no what? Somebody to talk. Without rehabilitation, there is no what? Hello? Hello? I think I'm talking to somebody.
Disability.
Jesus Christ. Who said that rubbish? There's no disability. Is that what I said?
No, sir.
So what is it?
Sir, no reintegration.
Priscilla, I know you are in the class. Without disability, there is no rehabilitation. Without rehabilitation, there is no reintegration. So it starts from disability down to rehabilitation, then down to reintegration. That is the sequence. Disability, rehabilitation, and reintegration. That is it. So we've talked about Tourette syndrome, which can lead to, tics, uncontrolled twitches, blinking of eyes, or shouting uncontrollably. Then the next one is paralysis. This is when the person loses the ability to move some parts, to move some of their body, or all of it. It can affect the face, hands, arms, or leg, or both, or one side of the body. Sometimes the affected part of the body is numb. Do you hear that now? Do you not get what I mean by numbness? Some part of the body is numb, painful, tingly, floppy, and stiff, which can make certain activities difficult. Then the last one there is epilepsy. Epilepsy. This is a common neurological disorder that impacts the brain. It causes people to have seizures. A seizure is a burst of electrical activity within the brain that temporarily disorientates the person. There are different types of seizure, but people can experience symptoms such as jerkings or shaking, sometimes referred to as a fit. They may lose awareness, become stiff, experience strange sensations when it comes to smells, taste, or tingling in arms or legs. And some people collapse. It is not uncommon for people to pass out and not have any memory of what has happened to them. You see them foaming in their mouth. Have you seen that before? Somebody with epilepsy. Have you seen any of such? Hello?
Yes, sir.
Yes, sir. Yes, sir.
They get injured, they hit their head. Even that can even lead to another brain damage. Brain injury. Because they just fall down, hit their head, oh my God. So all these are physical disabilities. So we move straight to the next one, which is invisible disabilities. It is believed that up to 70% of disabilities are hidden or invisible, telling you that the 10 we have just talked about and others are just 30%. Most of the disabilities are hidden, are invisible. So it is more important than ever to increase our awareness, more especially as social workers, and understand when it comes to all disabilities. Many people with invisible disabilities feel uncomfortable discussing their condition as they find it difficult to explain. People will not understand because they are invisible. By the time they are telling people, we say, but you are working now, but they won't understand. They find it difficult to explain to others. Others may think they are acting strange or off, but it can be really difficult for them to deal with their disability. And the reactions or lack of understanding shown by others can make the whole situation even worse. A person who has an invisible illness may think, hear, speak, or interact with others differently, as we don't always know a person has a disability. It can be challenging for someone to react appropriately. The best way is to improve our awareness, especially as social workers. Even when other people are treating them other way, you should know because you have understanding of visible and invisible disabilities. Always give them attention. The best way is to improve our awareness and knowledge of invisible disabilities and to accept a sense of openness when it comes to all disabilities. Many developmental and mental health issues are invisible illnesses, but there are a few other common conditions too. Hello? Hello? Can somebody talk to me?
We can hear you.
I can hear you.
Yes, sir.
I don't know any time.
Maybe, sir.
Don't tell me anything. Chuku, you are not in this class because I've taken my attendance before you joined.
No, sir. I joined though. I joined before you take the attendance.
When I counted the 8, mind you.
No, I was in the class, sir.
Chidera.
So I was here.
Chidera. Was he among the 8?
Yes, I was among the 8.
Was among the 8. Okay, fine. So let's quickly look at the invisible disabilities. We have bipolar, we have anxiety, we have depression, we have attention deficit hyperactivity disorder, we have obsessive compulsive disorder, we have Asperger's, we have diabetes, we have chronic illnesses. So let's see if we can take all this, but I don't know if you can, because the Zoom can just log us out because it is just 1 hour. It was fixed for 1 hour. But you people don't come to class on time. And when I was asking for more class, you were like, no, it's not possible. But you will at least know that this man is willing to teach, to give us time, but we are the one that say we are not ready. So we said many developmental and mental health issues are invisible illnesses, but there are a few others common conditions too. No, number 1 is bipolar. What is the meaning of bi? Anybody? What's the meaning of bi? What's the meaning of
That's
bi?
something that is two.
Is two. Thank you. And what is the meaning of polar? Bipolar means two extremes. So when somebody is having bipolar, it means that the person is operating from the two extremes. Two bi. It's moving from, is operating at a time it can be so much, extremely happy. All of a sudden, it will become so sad. It is a disability. That is called bipolar. Two polars. Two extreme polars. This is a personality disorder that affects a person's mood, and their personality can swing from one extreme to the other extreme. It means that in one instance, they may be extremely happy, and then the next moment, they could be angry or depressed. As social workers, who have you diagnosed to have such bipolar? Anybody? Bipolar. Do you understand what bipolar is now?
Yes, sir.
So I
Yes,
have
sir.
diagnosed myself.
Is that what? I didn't hear that.
So I have diagnosed myself to have bipolar.
Who is that talking? What's wrong with you? Chidera.
Sir,
Chidera said she's having bipolar now.
I did not say I'm having bipolar, but I do normally have mood swing. I'm happy then. The other time.
To the extreme, you get happy. To the extreme, you get depressed.
Yes.
Is that?
Yes.
Well, you need to work on that. It's not a good one. It's not a good one. It's not a good one. Any other person having that, at least we are social workers, you know how to take care of ourselves. And
Yes, sir.
who is that? Is that Promise?
Yes, sir.
Your boyfriend has left you, so you are in bipolar. Is that why? What is causing yours?
No, it's not about my boyfriend.
It's about what, Jare? It's about what?
So sometimes,
Yeah.
my friends, and like a normal discussion now, then change. They'll be like, "What is the problem?" I'll tell them nothing, that they should leave me for now. It's not as if they did something wrong to me, but my mood will change.
So work on it, work on it, work on it, because you'll be working on other people, our social workers. Can you see it is always good? If I just started the class and I just go straight to rehabilitation and reintegration, I would not have done anything good. I hope you know that. I wouldn't have done anything good. I just go straight to rehabilitation. Who are you rehabilitating? Who are you rehabilitating? Why are you rehabilitating them? You get it? So it's always good to know what is leading to rehabilitation. And at times we can also look at ourselves like you have done now. So we move straight to the next one, which is anxiety, fear. It is an invisible, disability. Many people will not count it to be a disability, but it is. This is a perfectly normal feeling, yes, which can sometimes become overwhelming and constant. When it gets to that level, problem has started. You can be anxious. It's a perfectly normal feeling, which can sometimes become overwhelming and constant, which causes a person to blow a situation out of proportion. What is it? Well, it's not up to that, and you are just shouting. It has been blown out of proportion. Anxiety is often a different experience for everyone. There are some people what they can, they call it the threshold. Their threshold, our thresholds are not the same. Our thresholds are not the same. What I can take, you might not be able to take it. Don't say because I'm at least I'm older. Even among yourself there are some shock that some of you will absorb and another person will break down. So it talks about your threshold, and that is telling us that anxiety is often a different experience for everyone. But most people suffer with feelings of fear, worry, and unease. If it becomes too overwhelming, a person may feel they have to avoid certain situations, and other feelings can make it difficult for them to communicate with others or live their daily lives in the same way as other people. Anybody in anxiety in the class? Anyone quick diagnosis? Anyone with that? So the next one is depression. Are we still together?
Yes,
Hello? Okay, fine.
Oh, yes.
Yes, sir. Yes, sir.
Yeah, I don't want the time to just lapse like that. That's what I'm checking. So the next one is depression. This is a mood disorder, and its most common symptoms is when a person feels sad for most of the time. Depression is setting. You feel sad most of the time. Many people report that they lack interest in life. And although sadness is a natural reaction, they struggle to come back from those feelings. You know, it is normal to be sad. But when you find it difficult to come out of that sadness, the person know they enter depression with that. Am I making sense?
Yes, sir.
Yeah. The person is entering depression gradually. Although sadness is a natural reaction, but they struggle to come back from those feelings as they last much longer and feel much more severe. Feelings of hopelessness, feeling of worthlessness, and helplessness all stem from the sadness. And without support, a person can find themselves unable to care for themselves properly and can struggle to communicate or interact with others. This can result in the development of destructive behaviors such as self-harm or suicide. So when you see somebody having this, depression tendency, suicidal thought is not far from them. You should quickly do something to talk them out of that depression. Are we getting that? So as social worker, know how to handle such case. So the next one is attention deficit hyperactivity disorder, ADHD. ADHD, attention deficit hyperactivity disorder. This is a neurological condition that causes a person to be hyperactive and impulsive. Common symptoms include being distracted easily, being unable to pay attention for long periods of time, having a poor working memory, feeling the need to fidget, to get scared, talk or move, and often acting without thinking. This means they are forgetful sometimes, come across as being impatient and rude, act on their impulse, and are unable to focus for a long period of time, which affects their life and work or education. Any patients in the house for ADHD, talk now so we can know what to do. Anybody with ADHD, anybody? At least check it out. Hello? Hello?
I know somebody with ADHD.
Okay. Is there an adult?
Yes, an adult. But like the
Does the
person is
person know?
around 20, the person is in his 20s. And
Does
the
he
person,
know?
yes, he knows. But the thing there is that it's really affecting him.
So what have you done to that? Or is just a friend?
So I've not done anything about it because I just got to know recently and I'm still looking for what possible means to handle the whole issue.
Is the person very close to you?
Yes.
Okay. Maybe we talk about that later.
Okay, sir.
Okay, fine. So you see, all this, okay, before now, did you know it is ADHD? Did you know that was the problem? Or because of the what? Do you know that was the problem?
No, I didn't know that was the problem. It
But what I've
was
just listed out show the direction, I guess.
yes.
Okay. So it's a pity for those who are not in the class. It's not that you listen. Well, thank God that this class is being recorded. Thank God and you can listen to it over and over and over and over and over. That is one thing you have at least you have gotten. That's okay. Let's go to the next one. It is called obsessive compulsive disorder. You know, there are two powerful words here. Too powerful. The first one is obsessive. When somebody is obsessed, what does that mean? There's what we call obsession. What does that
And the
mean?
person is crazy about something or
Oh my
attached to that.
Chioma, who was that guy that was obsessed of you? Tell me the truth. Talk the truth. Will be put to shame.
Nobody.
Chioma, when
Sir.
somebody like he cannot do without it, you get it?
Yes.
So now look at obsessive and compulsive. What do you mean of compulsive? When somebody is under compulsion, what does that mean? Can somebody help me out? When somebody is compulsive and obsessive at the same time. Hello? Hello?
We can hear you, sir.
So what does it mean to be compulsive?
Compulsion.
Compulsion.
It means irresistible. When you can't resist something.
Using force.
Yeah.
You are not under compulsion. You are not under force. But this one is somebody who is crazy about something and there is a force pushing that craziness. So if somebody is, obsessively under compulsion, the person can do anything to get what he wants. That is just the meaning. And it is a disorder. Are you getting my point? It is,
yes, sir.
It is an invisible, it is not written all over on the forehead of the person. That the person is obsessive, is having obsessive compulsive disorder. They could do anything. They could just do anything. You get it? It's a disorder. This is often referred to as OCD. It's often referred to as OCD, obsessive compulsive disorder. It is a mental health condition. Can you see? It is a mental health condition where a person develops compulsive behavior and has regular obsessive thoughts. It can develop at any age, but symptoms regularly start around puberty. Although they may not be obvious until the person reaches adulthood. This condition is distressing for sufferers and can impact their life because their fear take over their life and prevent them from doing the things they want to do. Their feelings cause anxiety, unease, and sometimes disgust as they don't want to have these obsessive thoughts. They are unable to control their compulsions, which are often brought on by their negative thoughts and feelings. Do you have anybody who is having OCD? Anybody in the class, you have this OCD. Talk now
I
so
have
we can.
somebody.
Okay, who is that person, Chioma?
My friend.
Does he or she know that she have OCD?
Yes.
He knows it.
Yes.
So what has he or she
But
done
he don't
about it?
work on it. He said it's his own way of showing affection towards something that he likes.
Okay, and he has showed that to you too, I guess.
It's not you. That is
Be
not
careful with such people because they can go to
Oh,
any
Jesus.
length you get it. With such people, you need
Okay.
to be very careful. And such people, please don't go out with anything they have. For example, if they have a girlfriend and they see another person with that girlfriend, something can happen. Sure, you know something can happen to that person.
Yes, sir. Yes.
You get it? Because they are just obsessed and there is a power pushing them which they cannot. They can be obsessed with phones. They can be obsessed with phones, with anything. They cannot control it. You get it? So the other
Yes,
one is ask
sir.
questions. Somebody want to say something? Somebody has left the class, and that is who left the class now? Is it Marianne? Marianne is still in the class. Who left the class? That what's the name of this girl now? What's
Comfort.
that? What do you call her name?
Comfort.
Comfort. It's Comfort that left the class.
Yes, sir.
Okay, oh, I know she's not in the class today with that. Then the next one is Asperger's. Asperger's. This is a developmental disorder which makes it difficult to relate to others socially. A person's thinking and behavior are quite rigid and repetitive. So they may find change difficult, which means life in general is difficult because we constantly have to evolve and deal with changes. Asperger's is a type of autistic spectrum disorder, and people with this condition may not understand their emotions or how to show them as they use fewer facial expression than others. Their speech can also be different as it can seem quite robotic or flat. They don't accept change. Their thinking, their behavior are quite rigid and repetitive. So they may find changes difficult, which means life in general is difficult because we constantly have to evolve and deal with changes, but they cannot adapt to changes. So that makes life so difficult to them or for them. It is a type of autistic disorder. You know what? Autistic, we said it has no cure. Do you remember that? But it is just a type of autistic spectrum disorder. And people with this condition may not understand their emotions or how to show them as there are fewer facial expressions, so that as they use fewer facial expressions than others, their speech can also be different as it can seem quite robotic or flat. So the next one is diabetics. Diabetes, we know that this is a health condition that impacts how the body turns food into energy. There are two types of diabetes. Type 1 is when the body's immune system destroys the cells that produce insulin. So a person has to inject insulin for the rest of their lives. Type 2 is when the body does not produce enough insulin. This can sometimes be controlled by a person changing their diet. But sometimes tablets are required. People who have diabetes must have regular blood tests and are at risk of developing diabetic retinopathy in the eyes. That's the retina. Retina is the eyes. Retinopathy in the eyes, which can result in sight loss. So people should be careful. And you like taking in sugar, too much sugary things. So that can also lead to diabetes. And this can result to sight loss, retinopathy. Do you get that? Are we still together? Are we still together?
Yes,
sir.
sir.
Okay. Oh. So the next one is chronic illnesses. This one is not just one. Chronic illnesses. This is when a person has a long-lasting medical issue that causes distress or pain and impacts the way they live their life. It can mean a person is at risk of other health issues too. Some chronic conditions become a burden on the person in terms of their morality or morbidity. Sorry, in terms of their mortality or morbidity. There are 12 common chronic conditions, and 2 of those we have linked to already depression. We have linked already depression and type 2 diabetes. The other 10 include heart disease, chronic obstructive pulmonary disease, COPD, kidney disease, oral disease, stroke, colorectal cancer, arthritis, asthma, heart disease, and osteoporosis. All these, I believe we've heard of. I don't know if you have heard of osteoporosis before. Have you heard of osteoporosis before? Anybody?
No, sir, I've not heard though.
Osteoporosis has to do, especially it affects women. Their bones break easily. Osteoporosis. It's something that affects the bones, and the bones get broke easily. Then the other one, the next thing there is common misconceptions and misunderstandings about disabilities. Is that we are going to finish this note today. By next week, I will have added, other topic. Then Dr. Kemi Ottun will come in. So can we take this before? That's the last page. Am I correct? Is that the last page?
Yes, sir.
Hello? Okay, let's quickly take it. Common misconceptions and misunderstanding about disabilities. There are many misconceptions and misunderstandings relating to disabilities. So it is important to address this now, as these beliefs can be harmful. Here are 3 of them. 1, people who are truly disabled need someone to care for them. We see them as burden, and they must always need somebody to care for them. Most people with disability actually learn to take care of themselves. They just sometimes have to do things a little differently. Most actually prefer to be responsible for themselves. So that tells you that it is not true that most people with disability always need someone to take care of them. At least I know one. The guy is on a wheelchair. In fact, the wife too use crutches, and both of them have their cars. They drive themselves around. Yes, it was the first time I saw, they use their hand to control the brake, the pedal, and everything. They construct the pedal for them. In fact, the guy has given me a ride before, and the guy was speeding like mad. A man who doesn't have leg, he's on the wheelchair. So that man needs nobody to take him around. He can drive down to Lagos, to anywhere from Ibadan. He's in Ibadan. And he's working with federal government. He's working with this University of Ibadan. So that is one, is a misconception. So change your mind about that people who are truly disabled need someone to take care of them, not in all cases. They learn to do things by themselves. Number 2, people with disabilities. Number 2 is that people with disabilities are brave. Being brave is not something that a person with disability will often associate with themselves. They simply accept that their lifestyle is different and they may have to lead their life differently to others and face limitation. It's not that they are brave, but they have come to accept the situation in which they found themselves. That is just it. Yes, they are. Because they have come to accept it. So, there is a saying that he who is on the floor does not fear fall. Have you heard of that before? Somebody who is already on the floor will not have anything to fear about falling. Is it true?
Yes, sir.
It is somebody who has not fallen that they are afraid of falling. So that is it. So that makes people to see them as being brave. And the third one is that people in wheelchair are chronically ill and unable to walk. We shouldn't make assumption when it comes to wheelchairs. They are a method of transportation and allow a person to move from one place to another. Don't just cross your mind and say people on wheelchair are chronically ill. You get it? If a person is temporarily sick, they may be taken into a hospital in a wheelchair. Maybe some of you have been on a wheelchair before. That doesn't mean you cannot walk. But so that as at that moment, you lack strength to walk. Am I making sense? So other people with medical conditions may be able to walk, but have reduced mobility. Therefore, they may have a wheelchair as a safeguard. So don't just cross your mind. When other people are saying it, you as a professional, you should know better. So with this, you're able to come to the end of the class today. At least, I believe we were able to spend about 1 hour because this is almost 1:30. And the class started around 12 something. So thank you. I really enjoyed the class today. I don't know about you.
Thank you, sir.
Thank you, sir.
Thank you, sir.
You're welcome.
Thank you, sir.
Okay. Enjoy the rest of the day and be careful before you go out. Watch before you go out. Take care. Bye.
Okay,
Bye,
sir.
sir.
Bye-bye, sir.
Yeah.
Thank you, sir.
Yeah, you're welcome.
Sir,
Who is that?
sir, it's Chidera.
Okay, Chida, I'm hearing you.
Sir,
Chioma,
about assignment.
come in. Chioma,
Sir?
we were talking last week, Che.
Yes.
Okay, don't worry. We'll talk later. Oh yeah, Chidera, I'm hearing you.
Okay, sir.
Sir, it's about the assignment.
Yes, you do the assignment now.
Sir, how are we submitting it? And when
You
are
will
we
collect
submitting?
This girl has not been coming to class. Oh. This girl in Gombe, what's her name?
Amuri.
Is she not aware of the classes?
She's aware.
What happened? I think this is our third class, am I correct?
Yes, sir.
Yes, sir.
And she has not attended any.
Yes, sir.
I hope other lecturers are coming to class.
Yes, sir.
Yes, sir.
I learned that you miss Mr. Julius' class.
Sir, we did not miss. He did not log in into the class. He's the one that missed it.
Okay, fine. Thank you. And has he giving you makeup?
I should collect it from them.
Has he giving you makeup class?
Yes, sir.
When was that?
Last week, that same day in the evening.
Okay, fine. No problem. So you are collect the assignment from them?
Sir, what about the people that are outside the Enugu state?
How many of them?
There are like 3.
2 of them. Amori, Okolo, and Marianne. Am I correct?
Yes, sir.
They will bill it to you now.
They will bill it to me.
Please, I'm coming. Just hold on. Let me pick this
What are they
text.
submitting? Chidera, what are they giving to you?
Assignment.
Hello, Madam Joy.
This one.
Yes.
Okay.
Hello, Madam Joy. Good afternoon. Hello, good afternoon. Hello, Madam Joy. Good afternoon, ma'am. They hear you now. They hear you loud and clear. I'm hearing you loud and clear.
All right. You've not said anything.
Chioma,
Sir?
so you are still there?
Yes, we are waiting for
Okay.
you to say something.
That was when Chidera was asking me about how to submit the what was it called? The
Assignment, yes.
assignment. And I said you should collect from you people. So she was asking me about
Yes.
those people in Enugu, like Daniela,
Yes.
Marianne, and Amori. But that
Mariana.
Amori has never even attended a single. That Amori has not attended a single class. Can
Yeah.
you imagine?
Yes.
Daniela,
Yes, sir.
is there any way you could get your assignment across to me in Enugu?
Sir, can
Is
I
there any
send
way?
it through email?
Email.
Yes, to your email.
You want me to read it, not submitting. Okay, you know what? I got to a point, don't worry. I will send my email address so you can all forward it.
Okay, sir. Thank you, sir.
I think that's okay. So you have five concepts there. Then I think I should limit you to maximum of five pages. Yeah, maximum.
Yes.
Okay, sir.
You get that? Okay. So Chioma,
Sir?
Chioma, when are we talking?
Sir, I'm here. Yeah.
You know,
I'm
you are not the only one. You are not the only
here,
one.
sir.
I know you are here.
You
You are
cannot
not
hear
the-
me.
I can hear you loud and clear. But we can you talk here? Chioma,
Sir? Hey, it's okay. Shake it. Sir, I can hear you now. Sir, can you hear me now? Sir? Sir? Sunshine.
Hey, yo.
Hey, before
Eh? Bom no my WhatsApp call. Phone na Zoom.
shout to can get tired. Yeah, I phone at the class.
For time my class, come na book by mommy.